Hi and welcome. I'm Bianca.
I'm Natasha.
And we are the co-founders for Bebo. So today we were talking to our hairdresser while we were getting our hair done. And she's 7 months pregnant.
And so cute.
So cute. And she was saying that, asking us, all these questions.
1,000 questions.
1,000.
Yeah.
And what we said, do you have a birth plan? What's your birth plan? And she said, my what? I don't have a birth plan. What is it? What is it for? So we thought, I bet a lot of other women have that question. So let's get into it. What is a birth plan? Why do we need them?
Why do we need a birth plan? So maybe you've heard about this before. Maybe it's something you've been thinking, I really should do that, but haven't figured out how or why. We're going to get into it really quickly. And if you have any questions, you can just comment below and we'll respond. But let's get into it. So why do we need a birth plan? It gives you a chance to research all your options around birth. So there's so many things that can happen during birth. You could have monitoring on the baby. You can have intermittent monitoring on the baby. You can choose different birth positions. You can have an epidural.
Your water broken or not broken.
Water broken, not broken. You can give birth squatting. There's so many options, and writing out a birth plan gives you a chance to really educate yourself on everything that can happen during birth. So you're prepared. If somebody comes into the birth room and they say, we want to break your waters, you can say, oh, I don't really want that. Or, yeah, great, I want to get this over with. Yeah. So it's really up to you to learn everything that you need to know about your birth. Typically, laboring women don't have the ability to say long sentences or really think that well during labor. They're very busy. They're trying to come up with coping mechanisms during the birth. Yeah, hopefully they're in the zone. And so writing down everything you have on the birth plan lets all the support people around you know exactly what you need during labor, how you want to be treated, and what interventions, if any, you're comfortable with. So that way, if somebody does come in and says, we want to break your waters, and you don't feel like talking to them right now, your partner or whoever's in the room with you can say, we talked about this, and it's not really on a birth plan. And if she does want it, she'll probably just say, oh, I changed my mind.
I do.
So don't worry too much about that. But it's a great starting point. Obviously, we don't know what birth is like. We've never done it before. For you.
we know what it was like for us.
But you don't know what it's like, so maybe you'll change everything once you get there. But at least you've learned everything you need to know, and everyone around you knows how to support you. It also gives you and your healthcare provider a chance to talk about all the things that you want, so that they can provide that for you in labor, or they can tell you, we don't do things like that around here.
Yeah.
And you guys can have some back and forth until ultimately you can have what you want.
Just keep pushing.
Yeah, as long as it's safe for you and the baby, obviously. And you can talk with them about things that you're not okay with. Maybe you're not okay with induction. And as long as you and the baby are fine, you'd like to be pregnant for as long as you can. And that's something you're going to need to talk with them about. How long
they feel comfortable.
How long do they feel comfortable? How long do you feel comfortable? Because it is your birth and your baby.
Yeah. So what would your birth plan include?
Well, typically a birth plan, I would talk a little bit about what I want pre-labor. So how long can I stay at home before I need to go in? Do my contractions need to be very active every 3 minutes, every 5 minutes? What are your options around this? It's going to be different whether or not you have any bacteria or reasons that you need to be in the hospital a little bit sooner.
You'd also have a difference if you had a doctor versus a midwife. So that would all be factored in to some of the things you'd have to include or not include. So if your plan is to birth at home, it's obviously going to have different points on it of, staying at home as long as possible, because that's your plan to stay there indefinitely. So
that's right. And what I was trying to think of was induction. Like, that's something you're talking about pre-labor. Are you comfortable with induction and what time? Are you comfortable with having an elective cesarean and what date? You want that at 38 weeks, which is typical, or do you want to wait at least until you're due? So many things to factor in even before labor begins. Then I would talk about your options around labor, and what I mean by that is while you're having contractions, between 0 and 10 centimeters, what positions do you want to be in? Do you want to stay off of any monitoring so that you can move freely?
Yeah.
Do you want
an IV? No IV?
Yeah, an
That's a
IV,
big
no
one.
IV. Do you want music? Do you want an epidural right away? You know, what are the things that you're really interested in? Start putting that down. And then again, you want to have options around birth. And what I mean by that is pushing stage. You know, do you want to be able to be off the bed to push? Do you want to be able to be on your hands and knees?
In water.
In water, yeah.
What kind of language do you want people? So we recently attended a birth where they really liked, you know, that yoga voice and really soft, versus some people love that cheerleader. Like, you got this, push, push, push. And it doesn't work for everybody. So.
And she was saying, you stop talking.
Yeah. You cheerleader stop, you yoga voice go.
Keep going. And that's different for everyone. I personally really like the cheering. And then you want to have your options post-birth. You know, what's going to happen with your placenta? Do you want to keep the cord attached to the baby for a while so the baby can get that extra blood flow? Do you want the baby skin to skin? Are you going to try to breastfeed right away? All of those things are really important to have on your birth plan.
You might include in that one as well, if you're planning to circumcise or not. These are the after-birth thoughts that you can consider and make notes of.
Mm-hmm.
So we have a few tips for making a really good birth plan. I know we listed lots of options. Ironically, you want it really short. So we really like catch-all phrases, for example, no medical interventions unless necessary.
Or an epidural right away. Like,
yeah,
wherever you stand on that.
For sure.
Yeah.
So you can clearly state, rather than, you know, for example, we have lots of people that are like, I don't want an episiotomy, I don't want my water broken. You know, they make a list, but they're okay with some of them. So that's where you can put catch-all statements like, you know, no interventions unless medically necessary, or something like that.
Mm-hmm.
It's great if you have it typed, because then anybody can read it if you have access to something that you can type and print. To list the people who will be in the birth room on there. So if you have a doula, you put their name down. If you have a partner, you'd put their name down. And anybody else that you expect you'd want to come in the room with their full names. So just so that the staff and your healthcare team will have an idea of who's the players around the mom who's in labor. We also suggest you make a couple copies. So it's nice if you do have a doula that they have one, that your partner, if you have one, or your friend or family member, whoever else is going to be in the room, that they also have a copy. And then your healthcare provider will want one. It's great to have an extra.
And any nurses that walk into the room,
yeah,
if you're giving birth at a hospital.
Yeah, they're nurses. Your nurses will also need one. Like Natasha mentioned, it's important that you do have these conversations early, so around week 35, 36. So if there is something that you feel really passionate about, you guys can meet in the middle. And if, you know, because sometimes you might need to push a little bit. You might not be able to give birth in water at the hospital without a midwife, for example. So that would be something that it will give you time to petition or go up higher and get those choices, you know, meet those needs. Or you might be encapsulating your placenta and your hospital might not release placentas. That would be something that...
And then we're getting a little deep into our
For example, though, you'd want to be able to meet all those needs that you have.
Yeah.
So just to recap, you want to type, you want it short and sweet, make lots of copies, and discuss with all the people that will have contact with your birth plan, just so that everybody knows that you're on the same page.
That's right. And, you know, it's really easy to feel overwhelmed. I know we just said a ton of things to you all at once. But pick up a book, The Birth Partner by Penny Simpkin. It has a list of all the options. It has very beautifully written the pros and cons of everything. And then you can make a decision for yourself. I feel comfortable with that. I don't feel comfortable with that. Oh, I'd really like to do that. And just condense your birth plan so it truly is the things that really matter to you. And that it's very unique to you.
And see it as a guide. Don't get really stuck like this is what's going to happen or I'm going to be disappointed. See it as a guide and a jump off for an education point and conversation point. So, you know, it's a great way to consider the plan. If you liked this, please subscribe to our newsletter. You'll get more blogs and video blogs. Vlogs, they call them these days, right to your inbox. And if you have any questions, please comment below and we will make sure that you get that information. Thanks for watching.
Thanks, guys.
Bye.
Happy birth plan making.